Dr. Patel is another great one under him.
Yeah.
He really is. He has a lot of feelings for you, and that's hard to get.
Dr. Dumajian here with one of my patients who underwent the Deuk laser disc repair. Lumbar spine, we fixed a couple of his discs yesterday in his lower back. And why did we do the Deuk laser disc repair surgery on you yesterday?
Because I couldn't walk and my back was killing me.
Okay. And how long did you have that back pain for?
Close to 2 years.
Okay. And do you still have that pain now?
I'm walking with no pain on my legs. A little pain in my back, but that's because of the surgery I did. But a couple days that should be gone.
Yeah. So the pain you came to me with yesterday at the surgery center, before we did your surgery, that pain in the center of your back, do you still have that pain?
No.
Gone.
Gone.
Cured.
Piazzo.
All right. Anything you want to tell everybody watching?
This gentleman right here that's doing the camera, he does pretty good with it. I've seen a couple of his films. They're really good.
Talk about Dr. Deuk.
And Dr. Deuk, what can I say? All right, he's rated the #1 in the United States, and he's been all over the world helping people, probably for nothing. All right, and he's unbelievable. And his staff is handpicked, and believe me, they are great.
Oh, I appreciate you saying that. I've got a great team of people. Can't do it without them.
Yeah. What was I'm having trouble thinking a lot, but the doctor I had that did the holes, what was his name?
Dr. Damola?
No, Dr. Patel.
Patel.
Dr. Patel.
Patel, the Indian doctor.
Yes.
Dr. Patel is another great one under him.
Yeah.
He really is. He has a lot of feelings for you, and that's hard to get.
Mm-hmm.
Like this doctor.
Passionate.
Yes.
Well,
Dr.
good.
Deuk, you're the best.
I appreciate
And
you
I want
saying
to tell
that.
everybody that.
Thank you.
People
very
in
much.
Connecticut know about you.
Good. Good. We want them to come get fixed.
All
Oh,
right.
and they're all moving down here.
Yeah.
All right, guys. Get out of here.
Thank you, Doctor.
Come on.